Abnormal respirations. In abnormal respiration, first one, bradypnea. Bradypnea means a regular rhythm pattern with a rate less than 12 per minute. That is known as bradypnea. This is the verb pattern of bradypnea. Here, breathing pattern is regular, but the rate will be decreased less than 12 breath per minute. Next one, hypoventilation. Hypoventilation means shallow breathing pattern with an abnormally low rate. So hypoventilation means it's a shallow breathing pattern and there will be low rate. Next one, apnea. Apnea means cessation of breathing. There is no breathing. And ongoing apneic spells can lead to respiratory arrest. So there will not be any wave pattern. If the patient is in apneic means the patient is going to respiratory arrest. And in apnea there is no wave pattern. Next one, tachypnea. Tachypnea means regular breathing pattern with a rate greater than 20 breaths per minute. So tachypnea means there will be regular breathing but the rate will be increased more than 20 breaths per minute. Mostly we are considered tachypnea is 24 breaths per minute. Tachypnea otherwise known as the polypnea. Next one, hyperventilation. Hyperventilation is deep breathing pattern with an increased rate leading to decreased levels of carbon dioxide and hyperoxygenation. In hyperventilation, what happens is there will be deep breathing pattern. The patient will take the breath in deeply. So that there will be decreased carbon dioxide level and hyperoxygenation. So that is known as the hyperventilation. This is the wave pattern of the hyperventilation. Here the wave pattern is deep breathing pattern. Next one, hyperapnea. In hyperapnea, there will be respiratory rate, depth and work of breathing are increased and common during exercise. So, in hyperapnea, there will be rate, depth will be increased. Mainly it occurs in exercise. Next pattern is known as chain stalk respiration. Chain stalk respiration means it consists of a series of respiration that gradually become deeper and noisier until a climax is reached. When a pause occurs, when a pause means that is apnea. When a pause occurs, then the cycle is repeated. An increase in rate and depth of respiration alternate with the period of apnea. So chain stalk respiration means here there will be a series of respiration that gradually become deeper and noisier until a climax is reached. So climax means here the apnea. When a pause is occurs, then the cycle is repeat. So chain stalk respiration, here there will be apnea and also there will be deeper respiration. So that is known as the chain stalk respiration and it can be seen in diabetic ketoacidosis and the kidney disorders. Next one, stridor. Stridor means it's an abnormal high-pitched breath sound produced by turbulent airflow through a partially obstructed airway at the level of supraglottis, glottis, subglottis or trachea. So the stridor that mainly occurs in case of choanal stenosis, enlarged tonsils or adenoids and if any upper airway obstructions or laryngeal obstructions And in case of laryngeal cancer, all these conditions, there may be chance for the stridor. So stridor is nothing but it is an abnormal high pitched breath sound produced by turbulent airflow through a partially obstructed airway, mainly at the level of supraglottis, subglottis or glottis or trachea. And there will be heavy snoring inspiratory sound occurring in coma or deep sleep. So in these patients, there will be heavy snoring inspiratory sound occurs, especially in deep sleep. And it along with the laryngeal obstruction, it can be seen. That is the stridor. Next one, orthopnea. Orthopnea refers to dyspnea on supine position. It results from increase in hydrostatic pressure in lung that occurs in assumption of supine position. Sitting up leads to rapid relief of these symptoms. So orthopnea means the patient can able to breathe only in the sitting position or in the upright position. So that is the orthopnea. The patient cannot sleep at supine position. Next one, Kussmaul's respiration or Kussmaul's breathing. Here, uh, Kussmaul's breathing, it is associated with metabolic acidosis, hyperapnea, then ketones, the diabetic ketoacidosis, uremia, especially in renal failure, then sepsis, salicylate poisoning, methanol poisoning, in aldehyde poisoning, all lactic acid poisoning or lactic acid accumulation. All these conditions, there may be chance for the Kussmaul's respiration. So Kussmaul's indicates the ketone, uremia, sepsis, salicylate, methanol, aldehyde and lactic acid. So Kussmaul's respiration is associated with these conditions. In Kussmaul's respiration, it is a rapid and deep respirations, and there may be labored breathing also. Rapid and deep respiration that occurs in Kussmaul's respiration. Next one, Biot's respiration. In Biot's respiration, it is an ataxic respiration. There will be periodic breathing, then hyperapnea and apnea. And here there will be the patient will have the poor prognosis, and especially the neuronal injury or head injury or brain damage. All these conditions, there will be Biot's respiration. It is the ataxic respiration, and here there will be a period of deep breathing and or hyperapnea, a period of hyperapnea, and apnea will be occurs. Wheezing. So wheezing is nothing but it is a high pitched musical whistling sound that occurs with the partial obstruction of the smaller bronchi and bronchioles, especially wheezing seen in asthma and emphysema patients. So wheezing is nothing but there will be high pitched musical sound. Sigh means a deep, very deep inspiration followed by prolonged expiration. Frequent sighs are signs of emotional tensions. So sigh means a very deep inspiration followed by prolonged expiration. That is known as the sigh. It mainly occurs in the tension. Then dyspnea means difficulty in breathing. The abnormal respirations are tachypnea, bradypnea, apnea, hyperapnea, chain stalk respiration, Biot's respiration, Kussmaul's respiration, and apneustic respiration. Apneustic respiration is nothing but prolonged respiratory phase with a prolonged expiratory phase. So eupnea is the normal breathing pattern. Tachypnea, there will be increased respiratory rate. Bradypnea, decreased respiratory rate less than 10 breaths per minute. Apnea means cessation of breathing. Hyperapnea means increased depth and rate of breathing. Chain stalk respiration is gradual increase in and decrease in respiration with the period of apnea. Biot's respiration, here abnormal breathing pattern with a group of clusters of rapid respiration equal to the apnea. Then Kussmaul's respiration, that is recurrent tachypnea and hyperapnea. Then apneustic respiration, prolonged inspiratory phase with a prolonged expiratory phase. So these all are the abnormal respirations. Thank you.